We're live.
It's September again, and this month has many different meanings to each of us. It's birthdays, anniversaries, the beginning of autumn. It's my goal today to let you know that you may be missing out on another important part of September. September is Childhood Cancer Awareness Month. Now, you may not think a whole lot about that because maybe children's cancer hasn't directly affected your family. But let me tell you, children's cancer is everyone's problem. Now let me tell you why. Cancer is the #1 cause of disease-related death among children. More than AIDS and all the other diseases combined, cancer is #1. This month is designated to spread awareness. Awareness is our most powerful weapon and the first step in our fight against children's cancer. More than 175,000 children are diagnosed with cancer each year. That's approximately every 3 minutes. 1 in 5 of those will not survive. According to the American Cancer Society, about 1,340 children will die this year in the United States. My daughter was diagnosed with T-cell leukemia when she was 14 months old, and I was like many people. I had no knowledge of these statistics, and I was unaware. I think that most unaware parents have the same response to diagnosis. They're shocked, overwhelmed, they're helpless, and they have plenty of questions. I hope to give you a little bit of insight to some of the important things today. The symptoms of childhood cancer are much like the symptoms for adults. They range from unexplained weight loss, headaches, pain in the legs, joints, and bones, lumps in the neck, abdomen, pelvis, armpits. They have excessive bruising and bleeding, nausea, vomiting, paleness, constant tiredness, fevers of unknown origin. The list can be long, or in my daughter's case, the list was short. She had knots in her neck from swollen lymph nodes, and she had a few night sweats. But other than that, she was never sick before her diagnosis. Most parents that we met at clinic while we were on treatment had the same story. Their children came down with a cold, they had flu-like symptoms, and no antibiotic would help them. Finally, a CBC was done, which is a blood test, and it showed that the white blood cell count was completely abnormal. Currently, childhood cancer research funding accounts for less than 4% of all cancer research funding allotted by the federal government. 4%. That's not a lot. And the causes of childhood cancer are largely unknown. Some stem from genetic abnormalities, such as children with Down syndrome are more prone to develop cancer. Other factors are radiation exposure, environmental toxins such as pesticides and solvents. Benzene is a chemical we use daily. It can be found in almost all of our products at home, such as our dishwashing liquid, and it has been linked to childhood cancer. There is no prevention, and no one is immune. Childhood cancer strikes all the various walks of life in our youths. The treatment for these cancers usually involve radiation, chemotherapy, and surgery. My daughter's journey included all 3 for more than 2.5 years. Sometimes these children go through treatment for much longer, and sometimes they relapse and have to start all over again on a new treatment. And sometimes they relapse again and they have to go through transplant. And then sometimes there's nothing else they can do. An important thing to remember when considering the lack of funding toward children's cancer research is that there are no children's chemotherapy drugs. All these kids on treatment are taking adult chemotherapy drugs with the same toxicity, just in a smaller dosage. The survival rates have increased drastically from about 50% to 80% since the 1970s. However, the diagnosis rate also increased, and about 2 out of 3 survivors have side effects from their treatment. They include secondary cancers, infertility, organ damage, chronic hepatitis, impaired cognitive abilities, and psychosocial impacts. Where do you go when this happens to you? There are many fantastic children's hospitals nationwide, but only one here in Mississippi. Larry Batson Children's Hospital is right in our backyard, and this was another fact that was unknown to me when my child was diagnosed. It is important to know your options. There are many great organizations out there working to spread the word. Please be an advocate for our children. It's September again. It's Childhood Cancer Awareness Month. And when you spread awareness, you can save a life. Thank you.
Okay.